Welcome back to Desk Careers. I am so excited to bring another incredible guest. Today, we are zooming out to Indiana in the United States of America, and we're meeting with Dr. Sarah Ackah, MD, MPH, who is an internal medicine, pediatrics, and endocrinology fellow. Welcome, Dr. Ackah. It is so great to have you with me today.
Thank you so much for having me.
I'm so excited to be here talking to you. I know for me, it's an afternoon, but for you, it's early morning and your day off. So I want to give you a special shout out just to say that I really appreciate this. And I know that our youth watching this will also very much appreciate the time that you've given to us. I have so many questions about your career, about what it was like for you to make those decisions. But before we jump into those details, I'd like to take you on a little trip down memory lane, back to a time when you were a high school student and the idea of medicine may or may not have come to fruition. When did you know that this was the career that you wanted to have?
Well, I always knew I wanted it to be a physician, probably since age like 9. Um, Kind of the one and only time that any one of my siblings have had to go to the emergency room um, for an accident on like 4th of July. We had just an amazing ER doctor who just like was it. Like I was just enamored with this guy and like how he treated us and things like that. And really, I was just like, this would be a great career for me. And knowing how my parents are, it was just like, oh, you want to be a doctor? Okay, so if you set on that path, then you need to go straight on the path that you set out for yourself. So
That's amazing because when I do talk to medical practitioners, and I ask them, how did you know? It always goes back to a personal story. And what was it about that story that really made you think, yeah, wow, this is it? I think it's important that young people are able to connect the dots between the career and the inspiration. I think especially with medicine, young people have to write letters of applications to university. They have to state their big why, and many of them struggle and don't know really how to write it. How did you know this was it?
for me, like I said, during that like whole encounter, like how like caring and supportive just like the doctor was, because it was like me and 3 other siblings plus my mom. Um, and my parents are foreigners, right? So they come, it's like we all came into the emergency room and it was just like we were treated like so nicely and things like that. Um, so that interaction, I think, really had an impact on me, mainly because of the kindness, the respect, and the professionalism. I think all of that together just drew me into like, oh, this is a career where like I could be helping people on a personal level and on a professional level, which for me was just it. Like I just
Amazing.
kind of that's how I would want to present myself to the world as an adult.
So there you were, a young teenager, and thinking, this is what I want to do. Your parents are like, okay, that's what you want to do. Then you set yourself out to do that. Let's go back to your academic journey at that time when you went back and thought, what do I need to do to become a medical doctor? Were your academics in line with what your aspirations were, or were there some of the differences of opinions from teachers telling you, yeah, great, do that, or I don't know, Sarah, if that's the path for you?
I think as a teenager, more so just because I went to a very, very big high school with a very large dropout rate. Um, but that once for my family, I'll say that my dad is one who will call us into the office and be like, "Hey, what's your 5 and 10 year plan?" So for me, it was like, well, if that's your plan, here's the steps you need to take. So here's what your academics need to be. So I sat down and, I had to come up with a plan for him to prove that, yeah, this is what I want to do. So for me, it was very easy to be like, okay, I figured out, this is what I want to major in college. And then I know I need to have this kind of a study plan and set mindset, and knowing what the steps were going to be after college of getting into medical school. And then from there going forward. So I had to actually like research most of that as a teenager, purely because my dad wasn't falling for not having a plan and not like doing my research and knowing what I was getting myself into.
And that's interesting that you say that, because there's two camps of parents I see in my experience. There's that camp of parents, just like your dad, who say young people have to take responsibility and accountability for the paths forward. They're not going to sit passively. They are really going to be in the driver's seat of what they want. And we're going to help them do that, but they have to have a plan. And then there's camp B, where parents are saying, oh, I didn't know what I wanted to do. And, why should I expect my young teenager to? I'll just let them figure it out. And it's almost for young people, listening to the various opinions of peers and friends and even educators, which side of the camp should they be paying more attention to? So I know that you can only talk about it from your experience. And in your experience, you were in camp A. Dad said to have a plan. You were focused. Would you say now that you look back that was more empowering for you, or would it depend on your personality as well? Because you would have gone to school with medical doctors who didn't have a plan at that time, and they would have kind of found their way. But with the rigidity of the structure of studying medicine and the patience required and the discipline required, was it better that you had a plan? Or do you think it wouldn't have really made a difference?
And I've thought about this because I talked about it with my sisters, because there was different parenting styles that happened in my household between the four of us siblings. And so it really is personality dependent for each child. I will say that. For me and my middle sister, it was definitely something that we needed. Like, we needed somebody to say, hey, have a structure in your life, sit down, discipline yourself in order to get forward and keep moving. Because I am definitely one, I will say, if I don't have a plan for something, then I'm just not going to end up doing it. Right? But if I have a structured like outline of some sort, I can get it done in a timely manner, versus like my baby sister, that's completely like not going to work for her. Right? Like you can ask that girl like what she wants to do, and she'll say one thing, come up with some fancy plan. She has no intention whatsoever of following through with any of those plans. She's a free spirit. You let her go and do whatever she needs. Okay, so even in the same household.
So what I'm hearing you say is it worked for you, and your parents knew that that's what you needed. So
yeah.
For any parent watching this right now, or even an educator, is know the individual in front of you. There's not one size fits all for the youth, which is incredible. Okay, Sarah, so let me zoom you forward to, you made it to medical school. There you are, first year, first day, looking around the room. Did you ever for a minute doubt that that was the right thing for you? Or did you think, I am so ready for the next years of my life?
I think for all of us, you have that moment of doubt. Like, you get there and probably in week 2, you realize, or for some people, it's probably week 1, I'll say. You get there and you realize just how much detail of anatomy and biochemistry you need to know before the first test even comes. And you start questioning yourself a lot. Because you thought you were ready. But then you get to med school and you realize, oh, maybe I wasn't so ready for this. And I definitely had those days where I just was like, I could go back home and be doing this and that and da 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 da, but I don't know. But I will say the one thing I remember on day 1 of med school, the head of the anatomy department got up and told us, um, that it is going to be a very, very rough ride for us throughout the process. But if we, instead of focusing on the problems that we're going to have while we're in the short period and time span of medical school, think about our future patients and how all this studying is going to help somebody else along this path once you've completed, that it'll be worth it. I think keeping those kind of mantras in the back of my head always help. Plus, I was one that was very, very blessed to have a mom that I could call and complain to, which I think everybody needs to have that one person in their corner that when things get rough, even if you're saying you're going to quit, but you need somebody to encourage you on a regular basis. I think you need that person, that one person that you can go and complain to, but will uplift you by the end of it.
Amazing. So just to be sure, was your mom listening and just letting you talk, or was she saying, I don't think so, Sarah, you will finish this program? What kind of, because I know parents wonder, what do I say that will encourage them? Because I sometimes think I might be saying the wrong thing. So what were the things that she was saying that you thought this is what more young people need to have in their life?
Like I said, she lets me rant and rave for a little bit, especially whenever I'm having a really rough day. And then at the end of it, when I'm done, then she'll be like, but you still can do it. At the end of the day, you can still do it. Like, you can get through this. It's a rough day, but you'll get through it. Think about these wonderful patients that you have, or think about, this experience that you had where you thought this was so rough and you wouldn't have been able to do it, but you were able to do it. I think there's probably a couple of times she even prayed with me because she was just like, you just had it rough today and you just need an uplifting hand, and I'm not there to help you physically. So let me just pray with you.
Amazing. Sarah, let me go backwards again. So I'm going to go back and forth. I think it's really a great way to kind of help young people resonate with where you were in high school, live the celebration and the reality of what that first couple of days and weeks were for you at med school. And I'm going to go back. So there you were. It was senior year. You needed to apply to university. And the time was now that you had to put the plan in action and state your intentions to the universities that you were applying for. This has got to be probably one of the experiences that I see young people go through where they're self-doubting. They are being met by gatekeepers left, right, and center. And at the same time, they're expected to really be able to understand who they are at a core and be able to put that down in 4,000 characters or less so that the university admissions officer can decide whether or not this individual may pass and get through for an invitation to interview. When you had to go through that experience, how did you put it all down on paper in such a limited word count and keep focused on the action plan ahead?
So the good thing was my senior year, I actually had like 2 off periods that I spent being like the school counselor's secretary. So that was just free time. And basically I just spent that time, like I would jot down notes, just random thoughts and stuff like that I would have about like things that I want to accomplish. And I also would like put down thoughts of like things that like reasons why I want to go to certain universities. And then after about a month of that, I think I sat down and finally like had to make that come into cohesive paragraphs for me and say like, okay, these are my reasons for going to college and specifically wanting to go to these colleges or universities. And and then, obviously, because I was already like with the counselor, I was able to like, after I like got a good draft, like probably my third or fourth draft, then I was able to like let somebody else read it. Because, sometimes if you look at things for too long, you can't see the errors of your ways.
True.
So I then like gave it to, because I was for two counselors, I was being their secretary. So I gave it to both of them and like let them look over it, make any edits and things like that, and say like, hey, am I on the right track with this? Like, am I putting together the thoughts in my head and like expressing myself in a way that like you who knows me feels is truthful, and expressing the real me. And they gave me a couple of tips. So I would say, for one, just sometimes don't even make it a big deal. Just jot down different notes, for sure. And then let somebody else look at it, because they can tell if it's like somebody that knows you well, if it's the authentic voice of you, or is this just something that looks like more academic and not something that would stand out.
Such an important skill to have. And I know many adults who still haven't enhanced that skill of critical inquiry and really understanding who they are. How did you learn to do that at a young age? I mean, for anybody watching this, let's put this into perspective. Sarah, you must have been, 16, 17 years old? Mm-hmm. So how does a 16-year-old know who they are and be able to put those things down? And I know watching this right now will be a student who has spent probably the last 11 or 12 years becoming, as great student as they can. And what that means is getting the highest grades they possibly can and trying to be a curious learner. But here you are writing this letter, trying to make sure that your authentic self is coming through. What are some of the tips you can offer a young person to be able to do that?
It takes a lot of introspection, and I'm naturally an introvert, so I'm always going to be on the observation side and be a lot more critical, of myself and others around me. So in that way, that's probably what centered me more. But also, again, like I said, the high school I went to, the friends that I had, we all were people who like will sit down and have very, very deep conversations, even from a young age. So, I mean, we've sat down and talked about like all kinds of stuff, just in general. But I think for someone who that doesn't come to naturally, someone who's an extrovert doesn't really sit down and like have that inner voice that like will look at your internal voice and things like that. I think it's good to do like meditation, to start to do something to like calm yourself down, give yourself at least 20 minutes a day to sit down and just reflect on your day, yourself, and how you're feeling mentally and spiritually. I think those things are like super important for teenagers. And I understand it's like really, really rough out there because I mean, there's social media, there's, the friends, there's us going through the pandemic right now. I mean, it is really rough, but I think it's super duper important for mental health and everything else, that you take that time. Even if you're not doing it every day, at least once a week, take 20 to 30 minutes to sit down and just reflect. I also was a big journaler back in high school. So that was another big thing that I did. Meditation, prayer, sometimes even just, like I said, counseling. Because like I said, I'll be open and honest. There are times that I've definitely went to counseling just for, whatever issues I felt like I needed to go and resolve, which I think be super helpful. So those things, like implementing at least one of those things can help you like figure out who you are.
So important to figure that out. Okay, Dr. Ackah, tell us, what is it really like to be a doctor? What's it like to do internal medicine, pediatrics, and endocrinology?
it's interesting. So there are days that you're going to love it. Some days you're going to hate it. Other days you're going to be, mixed up. But for me, I know it's a passion. It is something that is definitely dear and close to my heart. So it's something that even with the more difficult days, even if I feel like, okay, I just dealt with a whole lot, like it's okay because I know it's my calling. Yeah, I don't always I tell people like, okay, yeah, you say you want to be a doctor, but do you really? um, Mainly because it is a lot of hard work and dedication to the job, the profession, to the constant learning, the constant growing. I definitely know that, like I said, med school stretched me. Residency stretched me even more. This pandemic for sure stretched me, and I grew in ways I did not know I was going to, but I did. And then fellowship now is just more of a learning curve. But again, it's more dedication to the academics, which is not something that a lot of people associate that I'm going to be a lifelong student. So as long as you understand that, and that, med school and residency, they're going to be rough. You get through it. Everybody does. You'll be fine. You're okay.
Now, for somebody watching this that is not familiar with the process, take us through the different terms. So you went to med school and then you did residency and now you're a fellow. What do all those things mean? I think sometimes young people need to understand the context of what terms mean so that when they are thinking about their interviews, they can drop these things into the interview and it can show that they're very aware of the process. So take us through it. Pretend we don't know anything about these terms. What do these things really mean?
Okay, no problem. So in the US, that's what I'll speak on because I'm not going to speak on I will later, I guess, speak on the international realm since I do know that as well. So after undergraduate degree, you will go to medical school. In the US, that is only 4 years long. The first 2 years are basically undergraduate, but on a very, very steep slope, where you're just in the classroom studying all the pathophysiology and basic science things, basically. The third and fourth year of medical school are your clinical years. So that's when you're in the hospital, you are able to see patients, interact with them, start learning more of the clinical aspects of medicine, and try to apply some of that basic science knowledge. And you will be when you're in the hospital, you recognize those people by the short white coat. That's easy one. The short white coat is the medical student. Then you graduate, you have this lovely MD or DO degree, and you become a resident. But your first year of residency, we call you an intern. Mainly because there's some people, basically some of the people don't start off in their actual specialty. They start off in something more general than that, and then move on. Like for neurology, they have to do their first year in internal medicine. Some of the urologists and other surgical specialties have to do that intern year in general surgery. And then you move on, whether you're going into a more specialized field or you're staying in a regular field. Like for me, I stayed in internal medicine and pediatrics. So then you become the senior resident, and you do that for another 2 to 5 years, depending on what residency you're doing. So I did, like I said, I personally did a combined residency in internal medicine and pediatrics. So I did 2 in 1 for 4 years. So you do that, and then you have the option of, once you graduate from residency, of becoming the big boss or the attending physician, or getting more specialized in a certain area of medicine. So like going like an internal medicine person that goes into cardiology or rheumatology or endocrinology. And so you will do what we call fellowship, which is additional training where you do more research and more clinical work, again, in that specific area of medicine. And then after you finish fellowship, then you become an attending in that specific field.
Wow, quite a process. So put it in numbers from 0 to now. How many years have you invested in your career?
In my career, okay, so like I said, 4 years of undergraduate. I did 4.5 years at SGU because I did my master's degree as well there. And then I went on, like I said, I did a combined residency. So I did 4 years of that. And now I'm doing a combined fellowship. So another 4 years. And I've just started year 1. So 4 more years to go. And then I'll be the big boss attending.
You really have to love what you're doing, and you really have to love the idea of learning. Did you know when you were set out to have that conversation with your father that this would be the numbers of years? Did you have that idea in your mind, or did you just think, oh, I'll just go off to uni 4 years, there I'll be?
Yeah. So for me, I went to med school to just be a basic pediatrician, like a general pediatrician, right? So my ultimate goal was, I'll do 4 years of undergrad, 4 years of medical school, 3 years of residency, and be done. And making money, go on, live my life. And then I, like many medical students, actually did my clinical rotations, did my family medicine rotation, and was like, I love taking care of the geriatric population. Like, we had patients in like the age range of 102 that we would see at the nursing home. And I was like, oh my God, I would miss this so much. So then I just knew, I was like, oh, I'm going to have to do more. And again, but then at that time, I was like, okay, I can do it. It's 1 extra year. It's fine. I'm just going to stay in primary care and that'll be it. And I really, really did plan on just doing that. And then I got into residency and was like, I don't like the fact that some of these adult people can't take care of type 1 diabetes, like that we have patients who are outliving their childhood diseases and people can't take care of them. And that was frustrating me. Specifically in endocrinology diseases. And so, and I didn't like some of the transfer of care, which is kind of more of where I like to focus more on the transfer of care between pediatrics and adult care. Transition of care. I don't know why I said that, but transition of care. And so then I was like, it's kind of my motto that, like, the thing that frustrates you the most is the thing that you need to be working in to fix the most. So I was just like, all right, I'll do fellowship. And then it was like, let's do my research and figure out where I can go for fellowship and what I can do and But it's working out. It's doing great. So
what's incredible is you have seen 2 ends of the spectrum as far as caring for human beings, right from the pediatrics to the geriatric care. What's that like for you as a doctor to see where it all begins and then see how life evolves and develops? That just must be, have you ever taken a minute to really take that in and say, How many doctors can actually say they care for those two ends of the spectrum?
Um, Not as many as you would think, because NetPeeds were small as compared to like a lot of the other programs, like the what we call categorical programs, so the internal medicine or the categorical pediatric program, and a lot of them don't want to. Plus, and I'll also say, I guess, family medicine as well, because in the United States, even though you can see both pediatric and adult patients, a lot of them do tend to see a lot more adult patients than pediatric patients. But don't get me wrong, there are some that still do. But for me, specifically as a person who graduated and now I'm board certified for board eligible for both, it's interesting because like I could go, like, let's just talk about my last week of residency, right? I was doing clinic. Yeah, I just had ambulatory clinics that week. And literally one day I went from my first patient being an 86-year-old that was in good health. Her only medical problem was high blood pressure, and sitting down and having a conversation with her and her daughter to talk about like how she wants to die. To my next patient being a newborn 4-week old, 2-week old that was coming in with the dad because mom was at work. And then my next patient was like a 16-year-old that was coming in just for like a regular check-in.
How do you emotionally prepare yourself for a day like that? Or do you just kind of wake up and go, today's another day. Let's see what comes through my office doors and just kind of go with that flow?
I think for me, it was semi like a preparation ahead of time. So like I would look at my patient list when I'm on ambulatory anyway, I would look at my patient list and be like, oh, okay, I'm going to be seeing this patient and this patient and that patient. And sometimes other people, like if other people have already seen this patient before, or you know the family, you kind of know what you're walking into. Other times I get a warning before I walk into the room from the nursing staff, which is always a great help. I gotta love them. And then other times, like they don't tell the nurse the real reason they came in. And so it's just a surprise for everybody because they tell the nurse one thing, you walk in there and talk to the patient, and what y'all end up talking about is something that, you know, might have you crying after you go home. So I've been on all extremes of it. I think, again, because I'm an introvert and I take time to reflect on that on my day, like that's a daily thing for me. It's very easy to like, I have my set aside time to reflect on things and process emotionally what happened. And then, especially like I said, during COVID, even it got to a point like even that wasn't working. So I had to like my day off was me going hiking in the woods by myself to reflect on like what happened during my week. And it worked. It worked very, very well. Take like a 2-3 hour hike, go all around and just reflect. Because some days it is hard. Because every once in a while, you know, you are going to lose a patient. And sometimes it's expected, sometimes it's not. But even when it is expected or not, like you still have that attachment to another human being and to their family, to their story. And sometimes it's going to be an emotional burden sometimes. But it's something I came in prepared to deal with. Like I knew it was going to be an emotional roller coaster and I was okay with that.
I love that you're talking about the human side of being a doctor. And I think this is something that young people don't really take the time to reflect on. And it is the one thing that I think any patient that has ever seen a doctor to be in the room, there has got to be a level of trust to feel safe that this doctor is going to be able to be the best person to care for the needs that we have to ask for. But then leaving the office, I think the imprint that a doctor has left on a patient is how they made them feel, and if they heard them, if they saw them, or if they were just another textbook case.
Mm-hmm.
Would you say that that is so important in your profession, or is it that doctors have to be detached, and so it is important that they do see the patient and talk to the patient as a textbook? Because there's two camps again. I think there's always going to be these two camps. How can you help a young person understand that there are other things to be learning other than what the textbooks are talking about as far as the content to be a doctor?
Okay. So this is actually something I stress a lot, specifically as a med peds doctor. I will say that I stress that a lot, especially to my third and fourth year medical students. The reason why I say that is, and I will give some context with that as well, is that my sister, my middle sister, is a surgery resident. So again, I understand the two camps of disassociating yourself, but also you need to have that human perspective. And I, again, like I said, as a med peds doc, I'm going to talk on that aspect of it. You have to see the patient as more than just a textbook. There are more things contributing to their health and how you are going to work with them in order and motivate them in order for any action plan to work, beyond just patients. Like, there's a lot that goes into it. Of like, well, what if they can't afford these medications because they've been the sole breadwinner and things like that. So I talk to my medical students in depth about that specific, again, because I'm a med peds doc, we are well known for dealing with very, very complicated patients. Specifically, the residency program I went to is well known for taking care of the sickle cell and cystic fibrosis patients. So those patients, they always come with some kind, not always, but a large majority of them have some kind of a social issue on top of their medical complications. And it's not like they can be completely distinct from one another, right? If they can't afford their medications or they are having, a very stressful home situation, and they end up in the hospital more frequently than what they previously were, like, I need to get to the bottom of that to help them, work through that. In order to help them not be in the hospital all the time, but also so that they have, for them, a better mental sustainability to deal with not only their medical problems, but their social problems. And so that's why I love for us to have multidisciplinary teams and rounds. Because I always know that I need to lean on my social worker for something. There's always a time where I'm going to have to be asking them something, because there are a lot of things and a lot of resources that I, as a doctor, yes, I'm in the community, but I'm working a lot. I don't know what all the resources are for the patient. I don't know how I can connect patients with certain things that could be offered to them that I personally don't know about. So that's why, like I said, we work with our discharge planners, our social workers, the nursing staff, and all the physical therapists, the occupational therapists, because all of that helps the patient. But I can tell you specifically, there are times when I have been there and heard other medical professionals that talk about a patient who I know specifically know that part of the reason there's some social issue that is a part of the reason that they keep having multiple complications or they keep having to come back to the hospital. And I just have to stop them and be like, hey, no, we can't just blame the patient for this and that. They have a problem, they need help. And it's also why I tell people you have to be compassionate. Sometimes you don't know what that other person is going through. You don't know the thoughts that's going in their head. You don't know how it's like to be them. you can empathize with them, but I can never beat them, right? So I, like I said, make it a point to emphasize that to my third and fourth year medical students. On the other hand, I know, like I said, my sister is a surgeon and she goes in and sometimes she just stays completely as detached as she possibly can at times, in order to get through her day. Because there are some days that she's just going to have a rough day. And there's been times when she called me and was like, okay, I couldn't, like, I was just in the middle of this situation or multiple situations at one time. And again, there is somewhat of a personal aspect to every individual patient. They aren't just a textbook. We tell people all the time, like, patients don't read textbooks. They aren't going to present to you like what the textbook said. So yeah, the textbook was nice for a reference point, but just throw that away.
Yeah, it's time to be in that moment and care for each patient as they come through. What would you say are your top 3 career tips for a young person wanting to go into the medical profession?
Be flexible. Be flexible and open to the opportunities that are presented to you. That's number 1 for sure. Because like I said, if I had stayed rigid and said, oh no, I'm just going to stay in pediatrics and just do general pediatrics, I wouldn't be able to enjoy the things that I get to enjoy now. But be flexible. Yeah, I've had to, like I said, I've had to do a lot of growing in that area, but I think I've gotten it down now. So not only being flexible, I would say, don't give up on yourself. I know it's hard. It was hard for a lot of us. It's going to continue being hard. Medicine is everything. And it's expected that, you aren't going to know everything. Nobody does. And then just do your best and do your best at being you that you can for yourself and for your patients.
That's amazing. Great tips. Excellent tips. For a young person right now who really wants to be a doctor, but the gatekeepers are dissuading them, what advice do you have for that young person?
So I didn't talk about this earlier and I should have. I forgot to answer this question. So like I said, my parents were very, very supportive, but I did have people who were not for it and made other comments that I should do certain other things that, and I'm a rule breaker. So I was always like, just because you're going to follow those rules doesn't mean they apply to me. So for me, I always will find routes to do what I need to do to get things done. But I do understand that sometimes there are pressures that are out of your control. But I believe that if things are right for you, they will fall into place. With that being said, you do have to put in a lot of work for it. So maybe you don't get into the college that you initially wanted to get into. But as long as you do get into college, prove yourself, like just make sure that you prove yourself. If you need to transfer, if you need to make any adjustments or things like that, do that. But never stop trying. I would say that. I would say for sure, like, again, going back to being flexible, there are some times where changes don't go as smoothly as you would want and transitions don't go as smoothly as you want to, but be flexible. Definitely be flexible to new opportunities, new and different routes to do the same thing that you feel that is your calling.
Great advice. Super, super great advice. If you had to go back, would you do it all over again?
I tell people, there are days I say no. But today's one of those days I would say yes. I would do it all over again.
I think that you definitely would do it all over again. I think what I'm hearing, and I heard through the thread of this conversation, is it's worth it. It really is worth it. And the effort that you've put into your education, your experience, and your journey, it really sounds like you are where you're supposed to be. So I thank you for your for your time, Dr. Ackah. And I thank you for the care that you put into patients. We need more doctors just like you. And any young person watching this today, I hope that you are also inspired to create the plan and take the actions, just like Dr. Ackah did all the way back in her younger years when she was a high school student, just like you. Thank you all for watching. This was an incredible conversation. Today, we zoomed out to Indiana in the United States of America, where we met with Dr. Sarah Ackah, MD, MPH, who is an internal medicine, pediatrics, and endocrinology fellow. Thank you all for watching, and I'll see you at our next Desk Careers Digital Spotlight.